What causes bile duct blockages in liver health? Imagine your liver as a busy factory that produces bile, a fluid essential for digesting fats. This bile travels through a network of tiny tubes called bile ducts, which carry it from the liver to the gallbladder and small intestine. When these tubes become blocked, it can cause a backup of bile, leading to problems like jaundice, pain, and even liver damage. So, what exactly can cause these blockages? One of the most common causes is gallstones. These are hardened deposits that form when components of bile, like cholesterol or bilirubin, crystallize. Usually they form in the gallbladder, but sometimes they migrate into the bile ducts. When a gallstone gets lodged, it can block the flow of bile, causing symptoms such as yellowing of the skin and eyes, dark urine, and abdominal discomfort. Tumors are another cause. Both benign and malignant growths can press against or invade the bile ducts. For example, cholangiocarcinoma, which is cancer of the bile ducts, can cause narrowing or complete blockage. Tumors from the pancreas or gallbladder can also grow large enough to obstruct bile flow, impairing liver function and leading to symptoms like jaundice. Strictures or abnormal narrowings of the bile ducts often result from scarring due to inflammation, injury, or previous surgeries. Conditions like primary sclerosing cholangitis, an autoimmune disease, cause inflammation that leads to fibrosis or scarring, which narrows the ducts. Chronic pancreatitis, which involves long-term inflammation of the pancreas, can also cause strictures that block bile flow. Cysts of the bile duct, known as cold-ductal cysts, are dilations that can be congenital or develop over time. These cysts can obstruct bile either because of their size or because they cause secondary inflammation and scarring, which narrows the ducts. Infections and parasitic infestations also play a role. Infections like cholangitis cause inflammation and swelling of the bile ducts, making them narrower. Parasites such as liver flukes or roundworms can physically block the ducts by causing inflammation or forming obstructions. Injury from surgery or trauma is another factor. During gallbladder removal or other abdominal surgeries, accidental damage to the bile ducts can cause scarring or strictures that block bile flow. Similarly, blunt trauma to the abdomen can harm the ducts directly, leading to obstruction. Lastly, enlarged lymph nodes near the liver can press against the bile ducts externally. This lymphadenopathy can be caused by infections, inflammation, or cancers elsewhere in the body, and can squeeze the ducts shut. Understanding how these factors affect the anatomy of the bile ducts helps in diagnosing and treating blockages. The bile ducts inside the liver are called intrahepatic ducts, while those outside are extrahepatic. Blockages in either location can disrupt bile flow and cause liver problems. Treatments may involve removing gallstones, relieving strictures with surgery or stenting, treating infections, or addressing tumors or cysts through surgery or other medical procedures. In the context of liver health and liver cancer, recognizing the causes of bile duct blockages is vital. They can lead to bile buildup, liver cell damage, and increase the risk of infections or even bile duct cancer. Early detection and appropriate treatment are essential to prevent serious complications. Always consult healthcare professionals for personalized diagnosis and management, as individual cases can vary widely.